just a quick reminder, if you do have questions or you think of questions later on, please write them down and we'll try to route them for answers as well. And as always, thank you, Dr.
Thank you.
Okay, and moving right along into our next presentation, I'd like to introduce two speakers to give you a quick glance at HIV and tobacco. The first of the two ladies I'd like to introduce is Dr. Marian Evans-Lee. Dr. Lee's background includes over 11 years of experience in program planning and development, capacity building, and program evaluation as it relates to tobacco prevention and education. She graduated from Tulane University in New Orleans in 2002 with a master's in public health and recently completed her doctorate of public health at the Faye Bozeman College of Public Health here in Arkansas. Dr. Lee is the program coordinator for the Minority Initiatives Subrecipient Grant Office, try to say that real fast, at the University of Arkansas in Pine Bluff. The purpose of that program is to change society's thinking regarding tobacco consumption and continuing education in Arkansas. Her co-speaker is Gisele Hudson. Gisele has a Bachelor of Arts in Journalism from Temple University in Philadelphia, Pennsylvania, and has worked as a newspaper reporter for over 13 years in Philadelphia, Florida, and California. Gisele works as a community outreach specialist at the Arkansas Department of Health in the HIV STD section, where her duties include developing, coordinating, implementing programs in Pulaski County Jail, the Juvenile Detention Center, and she also works with a number of schools in the area. Gisele has also worked as a freelance writer for a local publication, Stand News. Please welcome Dr. Lee and Gisele Hudson.
Hello. Hello. Thanks for coming.
Yes, good afternoon. It is important for individuals to know the facts related to tobacco and the lesbian, gay, bisexual, and transgender, or LGBT community, as well as people with HIV.
One might ask, how are they related and why is it important to focus on tobacco prevention and intervention in the LGBT community and among HIV-positive individuals? Here are some facts.
The Centers for Disease Control reports that tobacco use has been implicated in cancers of the lungs, mouth, throat, larynx, esophagus, stomach, pancreas, uterus, cervix, kidney, bladder, and some forms of leukemia, cardiovascular disease, fatal heart failure, and stroke, sinusitis, bronchitis, pneumonia, emphysema, inflammation of the trachea, miscarriages, premature birth, birth defects, and especially low birth weight babies and babies with developmental problems. Secondhand smoke has been implicated in increased episodes of asthma and respiratory illnesses among children, respiratory distress, asthmatic and allergic responses, and cardiovascular damage among adults. There's also a growing body of evidence that suggests that there are carcinogens in third-hand smoke. Carcinogens are cancer-causing agents, but who knows what third-hand smoke is? Anybody? Have you ever heard of third-hand smoke? No. Third-hand smoke is the residue that remains after someone has stopped smoking. You know, second-hand smoke is the smoke from the lit end of the cigarette, but where does it go? In your lungs. It goes, and it also goes into your drapes, your clothes, your carpet, your furniture, your cars, everywhere. So if you know that person that uses tobacco and you're concerned about third-hand smoke, I want you to take this, just do a little quick test at their house. Take a damp paper towel and wipe a picture frame on the wall, and you will see evidence of third-hand smoke.
The American Cancer Society reports that each year about 438,000 people in the United States die from illnesses related to smoking. In fact, cigarettes kill more Americans than alcohol, car accidents, suicide, AIDS, homicide, and illegal drug use combined. Yet the impact of smoking is far greater for people living with HIV/AIDS. Smoking weakens the immune system and makes it even harder to fight off opportunistic infections associated with HIV. Smoking also increases the risk of HIV-associated malignancies and other cancers found among people living with HIV/AIDS.
In addition, the lesbian, gay, bisexual, and transgender population in the U.S. is most severely impacted by tobacco use. And although more members of this population believe smoking increases their risk of diseases such as lung cancer and heart disease, fewer have made quit attempts, with reports showing that on average, this population tried and failed to quit smoking 8 times, the same as all adults.
The tobacco industry spends more than $13 billion a year to promote cigarette use in the United States, and specifically targeting the LGBT community since at least 1991. Advertising both outdoors and in gay-oriented magazines, as well as through nightclub promotions and event sponsorships. One tobacco company document explains, quote, "A large percentage of gays and lesbians are smokers, and in order to grow the Benson & Hedges brand, it is important to identify new markets with growth potential," unquote. The stress of living in a society that sometimes is hostile to the LGBT community creates social stress that contributes to a higher smoking rate, particularly among young adults. With all the diseases implicated by the tobacco and further reported in the HIV population today, we focus on HIV prevention and tobacco prevention. We also stress that individuals know that their status and get tested regardless of gender choice. HIV does not discriminate. Be safe. We're offering free HIV testing today upstairs. Take advantage of it, and you may also call 501-661-2408 for additional information on free HIV testing. That's 501-661-2408, as well as Future Builders at 1-800-462-0599. I'll repeat, Future Builders, 1-800-462-0599. And I'll leave you with a tisket, a tasket, a condom, or a casket.
Tobacco prevention and smoking cessation is also vital to all people, regardless of gender choice. Diseases caused by tobacco use, secondhand smoke, and third-hand smoke have no respect of person. Be smart. If you don't smoke, don't start. If you do smoke, call 1-800-QUIT-NOW to get help quitting.
Thank you.
Okay, we're actually running just a few minutes ahead. If people would like to take about a 10-minute break, we'll reconvene at 2 o'clock instead of 2:10. So get up and stretch, and we'll be back, start again in about 10 minutes.